He said costs are still trending up, but things are being stabilized. He anticipates labor costs to increase 5 to 10% over the next quarter. Education costs are roughly running $250 to $300 per square foot, depending on site work and the size of the building. One contractor in the Chat area is currently completing a 70,000 square foot educational facility project, and it's going to be $335 per square foot. So he just said in this afternoon on the conference call, he said that expects our project to be around $400 to $450 square foot. The bottom line, things aren't. He's not seeing things go down. 10,000 square feet. I think today they probably go around 9,000. He did say that there will be time to stabilizing large HVAC equipment for full maintenance lead time usually 50 to 60 weeks. And then back May 22nd, Mr. Cooper and Mr. Ryder presented to you all the project that takes place at Dade High School, which consists of converting the facility area, the tennis courts, where you get the weight room, and then they can move the hitting facility upstairs to above the gym. Also, that project was to provide flooring all the way around the mezzanine gym, and then install flooring in the hitting facility, install the ceiling, and the lights have been installed, and then you ductwork HVAC. It's been repainted. The painting was a donation from someone here in the community, and the ceiling, ceiling grid, all the payment materials, the labor was donated. So the picture on the left was taken late Friday, and the picture on the right was taken last week. They come in and patch the area that was damaged from the previous equipment. So they'll come in, they're scheduled to come in and patch that area on the lower right. We're supposed to be here one day late this week, and then turf for that area is scheduled to ship next week, and then along the turf will go to the center area that's scheduled to be delivered or shipped next week as well. So once we receive all that, then weight equipment. It's getting ready to ship. Those have been 30 days assembling those pieces. And the weight equipment, the weight works there, that damage was called from the power cleans. It was rubber weights, that concrete slab was thick. And so we received a letter from our architect at that time to cease in weight upstairs, get heating weight off from upstairs. So we've got that accomplished. Last year we did put some racks in the heating facility on one side. And last year we did kids were racks in the heating facility on one side. And but just to give you an update, they should finish this project, within the next 2 or 3 weeks. But just to give you an update, they should finish this project, within the next 2 or 3 weeks. They should finish that. And as far as the flooring in the building, all that should be in this facility here on the left. They should finish that. And then in the hitting facility, it brought to our attention that, and then in the hitting facility, it brought to our attention that is connected right next to it, and the kids will be living late. And so we have a dead hole in that door, so nobody's to access that area from the weight room. And it's got a dead hole keys that door, so nobody's or access that area. using keys. Anybody needs access to that, the keys are at maintenance, so no coach, no evolution. Next item under superintendent's report is there's been a state board rule change for the Georgia milestones. This particularly relates to Dade County High School for students. Next item under superintendent's report is there's been a state board now our kids test and board milestones. This particularly relates to Dade County High School for students that take history in the course tests. Right now, our kids test in merit areas. And the state board adopted a rule of history change where districts can count the end of course assessment. The state board adopted a rule of change where districts can count the end of course assessment. There was 10%, it's 20%, up to 20%. Now the state board has adopted that rule. Prior to that, rule districts was the ability to give the minimum. It was up to 20%. 20% of the state board has adopted that rule. So the regular district has conducted to survey in the course 17 with 10%, 17 districts in our RESA director has conducted all kind of curious survey of our 17 districts. We want to remain consistent, particularly with that district's data that all kind of curious was districts that did. We want to remain consistent, particularly with our district's systems that are right here with Walker. And then enrollment update as of right now, as of 8/21, Dade Elementary has 700 enrollment update as of right now, and when the school year ended on May 24th, Dade Elementary has 700. Davis Elementary as of 8/21 is at 267. School year ended on May 24th, year ended 776. Davis Elementary as of 8/22 is at 267. When the school year ended, high school is at 586, and Dade Middle is at 422, so we're up. When the year ended, they were at 409 students. High school is at 586, as of August, they were at 597, so we're up. And now, John's two students, you have some information on bus routes?
Couple things, just to give you a little overview of our transportation, the buses. Right, we have currently 20 established bus routes. The problem with that, well, and so far the changes are right now delivering our 650 students transportation, the buses. Right, we have currently 20 established bus routes. We anticipate that to go up. Right now, there are 10 different. Problem with that, well, and so far this year, we are right now delivering about those seasons finished. Home's going to have an average daily taking home. That's close to about a third. Close to, we anticipate that to go up. Right now, there are 10 different student loads. We currently have 16 full-time drivers. Those seasons due to a nationwide driver shortage. Ours isn't bad for some. Worse shape than we are. But we have 4 part-time drivers here. This is how we make up the route. We currently have 16 full-time drivers able to just do because nationwide drivers shortage. Ours are man everything bad is route. So we have part-time drivers. 4 part-time drivers. This is how we make up the days off, things like that. We did have 2 shop mechanics and cell phones, pretty much regular drivers to take to man everything one of those routes. So we've condensed them. We have part-time drivers. And so that's a little overview of what we have. People get sick, days off, things like that. Next slide, 2 shop mechanics. I want to show you this. This is a new safety feature. Now, the pictures don't really do it justice because basically I am barely even know what talking what how that stuff is. And my ability I want to show you this. This is a new safety feature. But if you see, now one of the pictures don't really do it justice. Big safety feature. Basically, I barely even know what TikTok and all that stuff is. There is a critical issue going on nationwide. Stop signs. Those stop signs come out. But if you see, when the bus is loading, unloading students. Big safety features right now on bus traffic stops because we have kids on those stop signs. There is a critical issue. These stop signs are what alerts traffic. Stop signs. Those stop signs come out. The red lights is loading. But these were some of the newest things on the market. On the right-hand side, you have kids sometimes, you can play them. Did you play in front of the
I did.
bus? Okay. These stop signs are where road traffic. You can see the difference. On the right-hand side, it really doesn't do justice. It's even darker. These were some of the newest things on the market. On the right-hand side is the new sign. What happens is the entire sign lights up, not just the lights, but all the red. It's all LED lights, and it really, you can see the difference. On the right-hand side, it really doesn't do it justice. Particularly what we've done is we've outfitting the bus. On the left-hand side, where there's fog, what happens is the entire sign lights up, not just the lights, but all the mountain buses where the fog sets LED lights, and it's really, that's when we really have the near. It's very obvious from children, much further distance. It's so dangerous. Particularly what we're trying to cross out on a bus, outfitting the real foggy mountains. These things are designed to be able to see even in the fog. They do a great job. All the mountain buses of that, so they're very visible, and I think it's going to enhance. That's when we really have the near misses ahead of children, and hopefully prevent any issues from ever happening. Accidents on a bus, and it's really another good thing about this is our state, the governor put in last year's budget funds for safety features on buses of that. So we are visible, and I think it's going to enhance the safety feature of our bus signs in back state. Pretty hopefully prevent any issues from happening. Our superintendent allowed us to get 10 of them. Another good thing about 10 of them that's going to cover the state, the governor put in last year's budget funds for safety features on buses. And so we are going to be reimbursed really 50% of the cost of have signs out. The other thing I just want to show you, our mechanics, I was presented the surveying job allowed us to get 10 of them. What we've done is we have 10 of them. Notice all the older buses have those dome lights. And if you've ever ridden those older buses, especially when it gets dark, those dome lights barely light up anything. We've retrofitted all of our buses. The other thing I want to show you with LED lights, our mechanics are just, because it's daylight, you don't see it as well, but it really lights. What we've done is if you notice it even safer. All the older buses have those dome lights. Anyway, just a couple of things going on, especially when it gets dark, those dome lights barely light up anything. We've retrofitted all of our buses, all the older buses, with LED lights, and because it's daylight, you don't see it as well, but it really lightens the bus up, and it makes it even safer for the students on the inside of the bus. So, anyway, just a couple things going on in transportation. Wanted to show those to you. We're excited about them. Thank you very, very much.
Thank you for that. Okay, great. I'm George Williams from the Alliance for Dade. This is Sandy White, our president and CEO, and just giving you all gifts, which is part of what we do at the chamber. It's also do. Okay, great. Thanks for that. So terrific. First of all, I'm George Williams from the Alliance for Dade. This is Sandy White, our president and CEO. Our mission statement, you all gifts. This goes back several years ago. John, you were actually on the board at that time when we developed also do 2.5 years ago. Now, first of all, business and tourism enhance economic and community development and to serve as a catalyst for improving the overall mission statement. This goes back several years ago. Josh, you were actually on the board at that time when we developed the mission statement. Must be the 2.5 years, Holland, whatever. Business and tourism. So we went as a volunteer group for 2 years running catalyst for improving overall tourism of the Lake Chamber of Commerce. Fortunately found Sandy, it was October of last year, right? Must be the 1 year, Holland, whatever, crazy. So we went as a volunteer. Since that time, we've developed 2 years running strategic plan, Alliance, very in tourism for us to set a direction for the organization. Fortunately found Sandy, so here are the major bullet points. We want to focus on community development, which is through businesses, shops, restaurants. Since that time, we've developed a strategic plan, which is very workforce development. I'll talk a little bit more about this in a minute. Organization, more people working in Dade County. So here are the major bullet points to stay in work. We want to focus on community development, downtown revitalization, shops, restaurants, industry attractions to visit, Dade tourism, Sandy's workforce development, and some of the more emotional items that we have people working not only in Dade County, to develop students to stay in Dade County.
We want to promote downtown revitalization, amenities, downtown Trenton, and develop more activities for visit, tourism, Sandy's. And lastly, one of the organizational items that we have, we've talked a lot about locally, state. Actually, you all remember the chamber here in Dade County went away for amenities and develop certain activities for tourists and residents. We're going to work on increasing leadership participation, organizations to maintain. We've talked a lot about stability and transparency. Actually, if you all remember, the chamber here in Dade County. So, how do you fit in? And this is certainly one that we're going to work on increasing leadership participation in the alliance will maintain investment in the alliance, stability and transparency. Some of the things that we're working on is the job information hub, alliance website. So how do you fit in? The alliance builder, and this is probably a lot of you may receive payback for your investment. That has job opportunities today in the alliance. And we're going to continue to promote some of the things that we're working on. Social media, we have Trish Alliance website and how the alliance builders. If you're in the Welcome Center, probably she is amazing on social media builder. That has a lot of opportunities on today. To your point, social media, we can promote that. Social media, but we're getting a lot more interest about our organization, about our county, in the Welcome Center because of social media. She is amazing. We also want our social media to do job ready. We're getting a lot of, want to develop communication channels to let residents know about employment opportunities in Dade County. We're getting a lot more interest about our organization, about our county, and the job because of social media. So how are we working specifically with Dade County schools? We want to develop doing our annual career fair, which we've had a lot of fun in the last 2 years. The first year, in Dade's had the seniors. Last year, we did the juniors. This year, we've talked about opening up the sophomores as well. So how are we working 40 companies, Dade County, almost 40 companies. We're doing our annual career fair, which we've had a lot of fun the last 2 years. Very excited for them. Just had the seniors, kind of business there are in Dade County. This year, we've talked hard opening up people to understand, right out here, we had 40 companies, employ probably 1,500 people every last year, and kind of drive by there and don't even recognize, and that's very exciting for them to see what kind of businesses there are in Dade. We want to collaborate with Tanya Gatlin, understand, right out here, and also our employ Howard, 1,500 people every day on how can we drive by there and don't develop kids that aren't doing all that activity going on there on the different careers. How do we collaborate career path with Tanya Gatlin in Delaware in Dade County, and also Mr. Howard's. We're looking at the ideas of maybe how can we continue to develop Alliance for Dade Scholarship, not only for college students, but for the ones that are going into more career path, career them to see that area of Dade County. And we also would like to start talking. We're looking at the idea of maybe junior having Alliance for Dade. Alliance for Dade Scholarship organization for going college students, but for the ones mentorship, we want to develop relationships with students and locally. That's very important. And we want to work on. We also would like to start talking about. That's what we keep hearing from Alliance for Dade. Is that we want students with organizations who want to get in the school district. So Josh and I actually want to develop relationships with students and look where we're actually probably going to work in the middle and want to work on soft media skills to develop some. That's what we keep hearing from videos, our investors that might be helpful to students who want to job interviews, soft skills, or writing. So Josh and I actually kicked this around about 2 weeks ago, where we're actually probably going to work with the middle and high school education and business collaboration. Quick, we want to have more exposure with employer presentations. We want to job interviews, or actually coming into classrooms and doing presentations. And we can focus around items like education and business. We're going to work with the IDA, which is the Industrial Development Authority, with employer coming. We're going to have a Downtown Development Authority in Trenton, with partner for workforce development initiatives. People working there, we're going to try to provide the help and assistance to get some of our local people to not drive into other counties, but to stay right here and go to work in high-paying jobs. Internships, We want to work with students on a work-study kind of program where they can learn a job that they want to move to when they get out of school, but then also earn high school credit while they're doing that. The incubator, we're looking at possibly developing an incubator for entrepreneurs. This would be an opportunity if I have a business idea that I want to start, I don't know too much about how to get there. This incubator could provide maybe funding or expertise for writing business plans or actually getting the business up and running. Last but not least, we're looking for your ideas as well. That we need to learn how we can help the community even more. We'd like to thank Josh and all you principals. You principals that are in the room, I'm actually doing a presentation at Josh's next meeting. So you need to pay attention, because Charity and I were just talking about it. We're going to do a test right off the bat to see if you're paying attention tonight. Thank you for your time. Thank you for your investment. We're certainly really happy to have a great school system, and I do say a great school system that we like to work with, and we want to just do more. So thank you. And if there's any questions, I'll be glad to answer.
I just signed off on a purchase order, just based on Dave Ramsey's financial principles.
Oh, okay.
What grade level, is that seniors?
Mostly.
Yeah. Mostly seniors, and Miss Alicia Bell. She's been with us for a couple of years. She was at the middle school, but she's at the high school. She'll be teaching next year. So.
Great. We look for bigger investment.
High school, she'll be teaching next year. So.
Great. We look for other things. Thank you.
Thanks, George. Sure.
Thank you for allowing us to come and speak. I'm Diana Allen, CEO of Primary Health Care Centers, and this is Sandy Matheson. Sandy is our Outreach and Development Officer. Wanted to just give you a little bit of background about Primary. A lot of you probably know about Primary Health Care Center. The first facility was established in Trenton in 1978 as a nonprofit, and actually was affiliated in the beginning with what was called then Tri-County Hospital. The sole commissioner in Dade County at that time and the president of the hospital worked together to try to identify a physician to come into the county. At that time, there was only one physician working in the county, and he was retiring. So they worked together to try to bring in a doctor, and did it through an affiliation of Tri-County Hospital, this health center. In 1980, however, they applied for funding, federal funding, through the Health Resources and Services Administration, HRSA. They had, in the late 60s, created some funding, the federal government did, for nonprofit community health centers in rural and urban counties where, cities rather, urban areas where there were no health care services available. And the folks that were involved in developing this health center applied for that funding and received it, recruited a physician, and it has been in operation as a federally qualified health center now since 1980. So 43 years it's been in operation, has received that federal funding consistently, continuously since that time. In 19, well, I'm forgetting them. I'm getting old. The clinics began to grow and expand it was around 2008. It's coming back to me now. So since that time, we've grown to 11 clinics in 6 counties in northwest Georgia. Have grown a lot, have been able to get expanded federal funding to help support that growth. Our mission as a federally qualified health center is to provide comprehensive healthcare comprehensive healthcare services in the communities that we serve, and it's not only just medical care, primary medical care. We also offer nutrition services, behavioral health services, case management, social work, and a variety of other services that cover. Last year we served in the 11 sites with over 50 visits or encounters. So we've expanded a lot, grown a lot. 5 of our sites aren't school-based health clinics, so we do have a little bit of experience with this. 2 of those sites are in Catoosa County, 3 are in Walker County. Last year, or prior to last year, we were able to work with Emory University's pediatric program. They began to work with foundations for some funding to help health centers and other healthcare providers in the state do planning to develop school-based clinics in urban and rural areas in Georgia. There were, at that time, probably only a handful of school-based health centers in the whole state. So their effort was to expand those throughout the state. And we applied for one of those planning grants to work on development of one of our school-based clinics in Catoosa County, Tiger Creek Elementary, in Tom Hill, and then after a year or 2 after that, we applied for another planning grant for Gilbert. So, since then, we have continued to work for a lot of support, not financial support, but education and training for those communities that want to develop a school-based clinic. I'm sorry, I'm going to have a little trouble reading that. My glasses don't work that far. Okay, so as I said, our first school-based health clinic at Tiger Creek was opened in 2013. And we've collaborated with Emory, and we've received probably at least 3 planning grants, Sandy, since 2013 to work on developing additional school-based clinics in our service area. Part of the planning grant enables us to work with a school system to develop an advisory committee of school representatives and community representatives to help us figure out, is it appropriate to have a school-based clinic in that school system, and where would it be, and what would it look like? We don't go in assuming that we have all the answers by any means, so we try to get input from everyone in the community, or anyone that can serve on the advisory committee. As I said, we continue to have ongoing collaboration with Emory, and what we do after the completion of the 1-year planning grant is if the school system wants to work with us on developing the clinic, then we develop a memorandum of agreement or understanding on we would provide those services, what they would include, and then there are certain things, of course, that the school system needs to agree to as well. And it's pretty comprehensive, so if you all have some questions about that, we can talk about it. Our operational approach is that we hire the clinic staff and we operate the clinic on a daily basis with, under the auspices of primary health care, and it would be a satellite clinic of primary. Two of our sites are in modular buildings on the school campus. We are able to serve individuals from the communities at those modular buildings that are on the campus. The school systems have agreed that if there's enough parking and accessibility, that we can serve individuals who may not be affiliated with that school, that they're not going into the school, because there were some security concerns. So they can access us through these modular buildings. We have to get consent forms from the parents or the guardians at the beginning of the school year to serve those children. If the parents agree, the school nurse or someone can bring them to the clinic and we can see the child without the parent being right there. But we always also call the parent or the guardian before we see the child, even if we have a written consent, and make sure that they're still okay with that. Throughout the year, children show up, or we see the school nurse and we don't have a consent. We still call the parent or the guardian and get the verbal consent before we see them, and then we get the paperwork done after the visit. The clinic staff work closely with the school nurse and the school, the teachers and the principal and everyone about how you want those children seen, and normally they're escorted to the clinic, especially those that are outside of the school building. And the ones that are in the school, if the teachers and everyone feels comfortable that the child can find their way to the clinic that's inside the school, that's fine. We're okay with that. So that is, it's a very close relationship, and our staff develop really close working relationships with those school nurses. Our understanding about the funding, and we just learned about this probably a week before we had the call with you, Mr. Engel, is that the state, you all may have heard last year, or maybe it wasn't the year before, it was earlier last year, the governor signed a law to allocate a lot more state funding for development of community health centers. And they were targeting initially only rural counties. So that was why we were sort of interested in Dade County. We only have 2 counties in our service area that are designated rural, and Dade is one of them. But then we were notified about less than a month ago that the state had decided that some of that funding was going to be distributed to the school districts that were participating in a planning grant. So Dade County is earmarked for that funding, since we are participating in the planning grant with Emory. $308,000 of that, is my understanding, is for 2 years, and the school district can use it to either renovate space in the school building or purchase a modular building. The remainder, $682,000 for 2 years, will be allocated for the medical provider, and in that case, it may be primary, or you may decide to go another route. The money, the grant, does go directly to the school district, by the way. It does not come to primary, it goes to the school district. We would use it for expenses related to operations of the clinic. Some of it would go to some expenses related to starting up the clinic. The rest of it would go to support personnel, salaries, benefits, and some operational costs, expenses for supplies, equipment that we would need, and just other operational costs that we would have. We don't know, we were told that there's no application that's going to be required. There's not a request for anything. but we don't know when those funds would be released or when they would be available. I know one of the questions is, can it be sustained after 2 years? And we don't know at this point. Our operations require funding from not only grants, but patient revenue. And we're not a free clinic. We have a sliding fee program for those patients who are low income and uninsured. Those that fall at 200% or below the federal guidelines, federal poverty guidelines, and have no health insurance coverage. Those we serve on that sliding fee scale. The minimum fee for a visit is $30, and it goes up. That's what a sliding fee does. To, I think the maximum for 200% of poverty is $60. So we depend on revenue, patient revenue from Medicare, Medicaid, and commercial insurance, and then the fees for our sliding scale. We would be working during those 2 years to see if there's other grant funding that can be obtained, but a lot of it is going to hinge on the patient demand. If there is a clinic at one of the schools, what will the demand be, and is it going to be enough to sustain it, in addition to any other grant fundings after these 2 years? That's what I thought I needed to cover, but you all may have some other questions. Sandy can help me as well. She's been communicating and sort of coordinating and managing the meetings with the advisory council. There may be some folks here who are on the council, the committee.
So, thank you so much for presenting and explaining so well. What are the criteria that make it a good fit? You said the planning, the advisory council comes together to figure out if this is a good thing to do.
Mm-hmm.
Are there certain criteria that you look for in an area, the district, or a school?
Right, that's a good question. We look at our needs assessment data. We're required, because of our federal funding, to do needs assessment for our whole service area. And so we look at it by county, and we look at, what is the poverty level. One of the criteria is it a Title I school? What is the percentage of the free and reduced lunch? That gives us an idea about the poverty level. How many folks, or especially if it's a school-based, students, how many are on free and reduced lunches? And so we look at a lot of data like that to determine, is there really a need? We do surveys with the schools and the school system. You want to talk about that?
Well, yeah, we have surveyed and found some of the major things that are consistently that we hear from a lot of our school systems. But more importantly, I would like to say that we've been working with your school system for some time, specifically Dade Elementary and Davis, and we know that sometimes access is an issue and transportation is an issue. So we've been doing outreach in the Dade County school system for a good 10 or 12 years. But so we know there's certain areas that have more need. We know that there's parents on the line that can't always, one of the manufacturers talking about, economics. So this allows that child with the consent and communication to go ahead and be seen, and it actually has an economic impact, so those parents oftentimes aren't having to leave work to go get their child. The other thing we know, we actually have been part of a National Institute of Health study. We were one of the first 4 brick and mortar school systems to school-based healthcare systems in the state of Georgia when we opened at Tiger Creek. So we know that healthy children learn better, so we feel like if these students that are that have challenges at home, if we can keep them healthy, and in school, that they also increases their opportunities to graduate and become successful adults and go on either technical or to college system with a Hope Scholarship. But we're very committed to this, working in Dade County. And we want to help these students be successful, and absenteeism ultimately goes down. And something else we didn't bring up, but we also care for the faculty at the school systems as well, so it's actually helped with the substitution rates in many cases, and we also see the faculty's children and, you know, everyone in the school system.
So is there data that supports that lower substitute?
We can find some data for you.
What happens if children are diagnosed and they need an antibiotic or they need medicine, and how is that?
Well, we would have a nurse practitioner at the clinic. They can certainly prescribe, and we have an electronic medical record system, and those prescriptions are able to be sent directly to the child's pharmacy. And if the parents at work, they can go to them after they get off work. And it's pretty much of a smooth transition in terms of they see the child, they diagnose if they need a prescription, antibiotic, or anything else. The nurse practitioner would electronically prescribe it and send it to the child's pharmacy.
But there's a cost associated.
There is, I mean, we don't pay for the prescriptions, but we participate in a program called 340D. Because we're federally funded, we can participate and help. That program helps our patients get drugs and prescriptions at a much lower cost.
Also, in the state of Georgia, every child should be eligible for Georgia Medicaid. What we see oftentimes in our clinics is we may have a student that comes in that doesn't have insurance, but we have our social workers and our case managers that will work to get that insurance reinstated for them, which covers their insurance. But, you know, we work really hard to make sure it's seamless, and that child, we also have other means. We have a patient assistance fund. If we have a student or a family member that needs something that's not covered, oftentimes we'll work. So we're very comprehensive in making sure that those needs are met and taken care of.
Are you projecting or saying like you would have a nurse practitioner in each school, or you're saying it would be?
At the clinic, wherever
Okay,
the
so
clinic.
you have a clinic in Trenton now, so what's the difference if there's still going to be a student needing to be transported and then just going to the existing clinic?
That's a good question, and we've asked that question ourselves. We've been told that if it's a school-based clinic at one of the schools, that they are more likely to present to that clinic. Don't know, you know, why more students don't come to our clinic on North Main Street. I mean, that's a question we asked too.
And you mentioned something about if it was primary health care chosen, so are you saying that this grant is a matter of that the school has the option to choose any other type of healthcare clinic center in order to?
The school system can work with another healthcare provider if that's the decision. Doesn't have to be primary. We were approached because we had already gotten a planning grant, and we're already working with Dade County and the school system on identifying, you know, some issues and questions about a clinic.
Have y'all looked at the numbers to see how, based off of your current clientele, how much additional clientele you think you would be picking up from the students aspect? Like how many students you see at the existing clinic versus how many you think will actually come if it's within the school system?
We have access to that data, but we have not looked at it yet. We have a part-time pediatrician at our clinic here in Trenton, and we could certainly get that data. We don't track the children necessarily by which school they come from unless we are seeing them in the school. But we can get that data in terms of how many total school-age children we serve. We've got all that data.
Well, currently, a large part of that is having access. So, you know, you would hope, I think there's been discussion with the advisory group most recently of having it at Dade Middle School. And, you know, that there would work to be from Davis, you know, transportation down, and that we would work to be able to provide extended services. And in all the school systems we work, no matter where our clinic is is located. We have always served in Catoosa County. There's 17 schools. We work very closely with the homeless school liaison. So if there's a student that has needs or is recently homeless, to make sure, sometimes those students may have insurance, but they don't want to file on their parents' insurance. So we work very closely to make sure that all students in the school system are cared for.
How does your transportation part to that factor in? Who's transporting?
In that case, our social workers are given permission in the county to help with transportation. And sometimes coaches have brought students over too. We work closely with the athletic departments to make sure we're doing the back to school, anything sports related, sports physicals and those kind of things too. And we're also working to make sure that students, for example, at 7th and 11th grades, there's immunization requirements now, or if they need annual checkups, that we're working to make sure they're getting those annual checkups too. So it's preventative as well as acute care and chronic. We see children with diabetes and more chronic things as well, and are able to offer, the help with our dietitian or whatever needs they may have.
We don't transport that many students. Our transportation is more focused on the adults. And it's limited. We don't have a whole fleet of transportation vehicles, so it's limited. So we try to focus on those in the biggest need.
I'll be honest with you, we've had, when at Gilbert, we had, one time we had a bus driver with a student that was in need, and the bus driver just drove the student on over to the clinic. It saves lives, the time and being there. We've had teachers that have had heart issues and been able to get them, able to be transported into the ER.
We can get that data for you about the number of children that we served at our clinic on Main Street. Thank you. Appreciate it.
Next is Department of Security.
Before you this evening will be three action items for three grants that we have received. So this will be for you to formally accept these three grants. The first one is the Dade County Middle School ESSER Math Grant. Anna Thomas, teacher at Dade Middle, and Angela Melton applied for this competitive grant, and they were awarded and won the grant in the amount of $3,177. This is a competitive grant, so not everyone received it, so kudos to the middle school teachers. This is for math manipulatives and hands-on materials only, so there's some specific guidelines with this grant, but nevertheless, it is money that's going to go for children, math classes, hands-on type activities. That will be the first grant. The second one, we actually received word of this last week. We're really excited about the Safer Georgia Schools grant. This was another competitive grant, and Dade County won this grant in the amount of $250,000. This is actually a 2-year grant that will assist in paying the salaries of SROs. It's Dade County Schools portion of SRO officers for 2 years, as well as some professional learning. Professional learning will be geared around every year. There's a safety conference. I attended one this past summer. The SROs attend that in Athens, and it's a great opportunity to meet folks from GMA, local sheriff's departments. So we really want to encourage our SROs to attend that for the next couple of years. So that's the second action item. And then the third one, this one came from Governor Kemp. This is some ESSER 2 funds, and this will be for school custodian bonuses. There are 10 custodians that will be receiving a $1,000 bonus, and that will go out in August's paychecks. So it's just 3 grants for action items each line. Any questions?
Next is information information on Washington D.C. trip representatives.
Yes, talking about the DC trip a little bit, for Dade Middle Schools for 7th and 8th graders. Each year we've been doing, a trip with the kids. We had to take a couple years off when, COVID hit. And so we alternate each year, between Washington DC and then like this past year we did, a tour of Georgia. Previously we had done, a Disney trip, but we're kind of going back to Georgia instead. That way, it fits more in with the 8th grade standards. So the purpose of this is give our students the opportunity to visit our nation's capital and learn more about our history. The trip organization, so who we're doing it through, is through the Georgia Center for Civic Engagement. This is the same company that we used this past year. And so with them, they're going to handle all the registrations, all the payments, they've done all the planning for it. And it makes it a lot smoother for us on our end. To just kind of be like, hey guys, here's the information. When we do the parent meeting, the guy that represents it, he comes into the parent meeting, helps with any questions parents may have with it. When we go on the trips, he's there, or somebody from the company that is representing us. The dates we're looking at right now are May 6th through 10th, so that's Monday through Friday. Right after we would have the milestones testing at the middle school. I'm going to go through this quickly. This is just an idea of what the itinerary is. Leave the school at 6 in the morning on that Monday. And really on that day, it's just traveling. And one of the things about this is everything's already included. They don't have to worry about meals. They don't have to worry about anything else. The only thing they would have to worry is if they wanted like extra food or something. I know this past time when we stopped at like some of the fast food restaurants, there's a $10 gift card for each person. So if they wanted to go over $10, well, they would have to provide that. And then if they want to use souvenirs. Tuesday, they've got us down. Looks like a whole lot. Most of these are all really close to each other. The three that would take a decent amount of time would be the Smithsonian, both of those museums, and the Holocaust Museum. One thing that I liked about this itinerary compared to the ones we've done in the past is most of the time, by the time it was dinner time, we were done with everything for the day. That evening was at the hotel, so then it was on us to kind of keep the kids not being chaotic and things like that. Well, this one, the evening, we're going to these monuments and things that are going to be open at that time anyway, so we're going to get back later, and it decreases the amount of time kids can find ways to potentially get in trouble with. So on this one, there's a few evening ones as well. This one would go to Mount Vernon, home of George Washington, the Supreme Court, and the National Archives. On previous trips, we haven't gone to the National Archives, and that's, for me, it's been this one, because I think that's just a really good place to go to see, the Declaration of Independence, the Constitution, all that. So, making sure that was part of this was one of the things I wanted to talk to him about. And then on this day, it's Arlington, the Air and Space Museum, and the Twilight Tattoo of Fort Myers. I included a little bit about the Twilight Tattoo because usually when you go to a tattoo, you're thinking you're getting something or something like that. So that's really going to deal with a military appreciation is what that is. So it's going to involve the Old Guard, which is like it's the oldest active Army regime in the it's opposites Army regiment, so it's in the Army. But and so what they do is they just have this presentation, and they do different vignettes to kind of like tell stories of the American soldiers during this time. Because I asked them, because this is a new one for me, I haven't been to this, and so I've looked up information on it, and I've talked to the guy that's over the company that's putting this together, and he says this a lot of times ends up being one of the favorites on the trip. And then finally, when we come back, we'll stop at Monticello, and then just back to Dade. All right, So the cost of this, with everything going up, cost has gone up a little bit on this as well, so it's $975. That's for all 5 days. And if we're able to start next month with parent meeting and get the initial down payment, that would set it up to where it's 100 down for that first month, and then 125 for each month afterwards. And then if adults are going, or if students are staying 2 to a room, it's an additional 150 is what he told me for that. I think last year we had a couple students were there, but most of the time the adults it's 2 to a room. And then cards can be accepted. They do this all online if you need to. It is a 4% charge for cards, or you can do it by check, and there's no extra charge. One of the other perks of using this company is they do include insurance on the trip. And so with the insurance, if you have like specific reasons to require documentation, they can potentially get up to 100% back on the trip. If it's not one that would qualify for those, then you could still get up to 75% back on the trip that they paid. And this is like all the way up to the trip itself.
So the insurance is part of it?
It is part of it, yes. And so, I know that's something you guys will talk about later. I came up because the price has jumped up a decent amount. Because I want to say last year we looked at this and the tour of Georgia, and it's gone up a couple hundred just from last year because gas is up, lodging and everything. So we looked at potential fundraisers, and on these fundraisers it would be one where kids can sell themselves. And so that way, if this one kid sells, it would just go towards their price, and it would be just one, but we're having to figure out how to split it between everybody.
How many kids do you think will go, and do you hope will go?
That's the big thing, because the price is up some, I think it's probably, I would say in the 60 to 80 range would be, yes, on that. I know in the past, when we've done the DC trips, we've taken 3 charter buses, versus just 2 when we've done like the Georgia trips. With the price show, I think it's probably gonna be 2 charter buses on this one, but I'm hoping it'll be 2 to 3.
What's the potential?
I think we end up in the past years, we've capped it with the 3 charter buses. And so it's like a first come, first serve. And I think on those, I think it's 55 people per bus is what you could get. When I was asking about it, because he also talked about doing a potential for a double-decker bus, but that only held 80. And I thought if we had more, it'd be better to get 2 buses than that. He said there's really not a difference in the pricing.
So this is the 8th grade?
7th and 8th grade.
7th and 8th.
So ideally, they'll do DC this year, Georgia next year, you may go 7 or 8, you're gonna get that up.
Correct.
So you're saying an adult ticket is $975 plus another $150, which makes it $1,125.
Yes, ma'am.
So for a student and their parent, you're looking at $2,100.
Yes, ma'am.
Yeah, well, this is really good.
Thank you very much. I came to give some good news. We are partnering with Walker County Schools, and we've got 2 students, Michael Bradford and Skylar Ball, who are participating in a project search program. What it is for students in our functional curriculum programs who have completed their farming units, but they need some additional training on the job. And so I've asked the project search instructor, Mr. Casey Payne, to come and talk about the program a little bit. And then I want you guys to know that we are transporting Michael and Skylar to Lafayette every day, and he's working with, they're working with Mr. Payne and we're picking them up. So it's for foster parents and we're providing these services.
Thank y'all for having us. About our Project Search program, so our title is Project Search City of Lafayette. I left all the orange and black stuff on. So Project Search is a global program. There's over 700 sites worldwide. I think the latest one that just opened was in Iceland this past summer. So it is a global program for individuals with disabilities. It's a transition year program from school to work. It's a one-year program. Students can be 18 to 22 years old when they enter our program. And we follow an employability type curriculum throughout this whole year. I'm very fortunate to have Skylar and Michael in our program this year. I feel like they're my bodyguards whenever I was sitting there, sitting on my sides. But I'm kind of going to give you a little rundown of what the year looks like, because toward the end of the year, while they're away from you now, with me now, over the mountain, whenever we get closer to the end, that will look different. It will look like how they're going to become part of the community and grow from there. So the business aspect of it is really heavy, especially toward the end of the year. But we follow a school schedule, but they are everything but students. I don't even use that word. We don't have a classroom. I'm not their teacher. So they are interns when they're at Project Search. You can see what they're wearing what they're wearing right now is what they come to us in every day. They wear a uniform. So that's polo, khakis, talk about how to dress, how to look professional. So they have expectations from day one whenever they enter the Project Search program. It's very different than high school. They may have been in the same classroom for 2 years, 3 years, maybe 4 years, and with the same friends, same teacher. So it's a shock right off the bat. So for the first 2 weeks of our program of the school year, we're breaking those school habits and getting into what it looks like to be an employee and what that means. A lot of what we went over is like what a morning routine looks like. When you all get to work, you all do something that you don't have to think about. Like you set your bag in the same spot, you get your coffee cup, you get coffee. I mean, there's things you do to get your morning and you get your day going. And that's stuff that if we want them to be good workers, that's one of the things that we talk about. Can you tell me morning routine from the program? Now you walk in, what do you have to do first thing? Clock in. What else do you have to do? Clock in. Clock out when you leave. You have to grab anything when you come in. Lunch is over. Lunch is over. So first off, we had to go over the list. What does it look like? But now we're 4 weeks in, 4.5 weeks in. So it's still on the board whenever they come in, but the routines get there. So for those first 2 weeks, that's what we're honing in on. We have a curriculum that we follow that for the first 2 weeks for this year, we've talked about communication, what that looks like on the job. Like, what if a coworker says something that you don't like or that you don't agree with? Like, how do you handle that as an employee? It's very different than how you handle it as a student. So that's a lot of that just kind of gives you a little glimpse into the curriculum that we follow. Very, very work heavy. So after those 2 weeks, the interns will go into what's called a rotation. And a rotation lasts for 10 weeks, 10 total weeks, and it is hooked up with a partner within our host business. So our host business is Project Search City of Lafayette. We're with the government. We're under the government of City of Lafayette. So I had to present to like the department supervisors. And when I say that I think they opened up their department business, they really opened up a lot more than that. They opened up like experience for Skylar and Michael to be part of, and be around them, their co-workers, and just to learn where we work through that team weeks. So that happens for, so you're talking about 50 days of work experience that lasts from 9:30 in the morning to 1 o'clock in the afternoon every day for these first two interns. So they'll go to those rotations and they work first supervisor, they work co-workers, they have a lunch break, they'll eat with co-workers and communicate with them. And after those 10 weeks, there's a week break, where they come back into the office, project offer us, we have like those weeks. They'll also work on resumes, work on interview skills. We also work on what's called a one-page profile that tells a little bit about the things they like to do, their strengths, the job duties they have after their search. So we work on those with that break, and then they go out for a second rotation. It lasts 15 weeks. And then they go back for a week, and they go back out to 10 weeks. So you're talking about with Mike's guys finished on the project search, they'll have gone through 30 weeks of on-the-job training. To learn employability skills. We are program. Once that's over, our program's over. We have separate graduation, other than high school graduation or anything that's not affiliated with the school. Just our own project graduation to highlight them. But one of the biggest things about project search is that these guys are very able to get back to the community of Dade County and Trenton. And going through this program is that's what it's designed for. Not to strengthen their strengths and their interests. And then once we cross over Christmas, one of mine, I also job search. Our main job is to look at the community that our interns come from, look at what job openings are there, and what would be a good fit for our interns and for the community together. So you're not only talking about these guys being here, you're talking about the places all being as well. So it's really it's a great program. Had it set year after having walking, but we're so used to it and looking at changing things. So
Just a question, so my God, we're already ready to go work now, is that, so where is that?
Skylar is actually does our schools in the city, and then Michael is with one of our fitness club, just American also in the church.
So it's all in Walker County, because project search is in Walker County. But it does come back to Fayette County way, because they don't come, you guys can part of the work.
We actually had times last year that he moved half of the year here in Dade County. He's relatively still working in Walker County. But we had to do this last year. He finished the program. We had to reach out to Dade County, and it's actually with CDC and interest. So we already have a connection. And it's already impacting your community.
There's a minimum number of students that have a program funded, and we just don't ever have enough students in the organization, which is why our resources for the districts is very.
Plus, it's also one of those things where this is an option not talked about a lot. It's not a good thing. Like we're community education students who have after high school. And there's not really an option to fill that gap. And I push these guys forward. So that's what Project Dade does. Even like your middle school, middle students, they'll parents say, hey, there's an option. Once my student graduates or leaves high school,
So we reach out to those entities and things or wherever they usually receptive.
I only researched a couple last year just because I knew exactly, or intern exactly what they wanted to do here. But the alliance is very.
These guys are our first ones to participate. Students from last year's so we're just very excited to get cases for the council and other businesses that are on that council. So that's the goal is for them to give training back here to be
I have everything for you, we're good. Congratulations, gentlemen. He did his business, get on short, and we walk around briars. So, in the back way, we did. So, pretty well, we made it, so, thank you.
Dade County Board of Education understand the role of the operations of Dade County Schools. Through regular scheduled board meeting, time set aside to allow This is an ordinance policy. Publish your participation all the shall remember that means our public service is not used to having business and members of the board participate as allowed by policy procedures. Rules of conduct and participation procedures. Signs, flags, banners, inside the board meeting. Only residents of the district represent businesses or organizations located in the district, parents or students of the district, or school system may address during participation. Each member of the public participating in public comment will be given 5 minutes to speak. The public can speak shall state their name and address and the board or share may hold the time allocated for participation as well as further and individual comments during participation and expression of the officiation ratios of business. If there are numerous ways to address the main issue of any request that representatives issue or limit the number of speaking authority against specific issues. The presentation should be as brief as possible, yet include all necessary information speak. Unless the chairperson grants the time to request any material given to the superintendent or chair of the district. the use of physically threatening or racial remarks and comments conducted by the speaker or members of the audience that result in destruction of the meeting will not be allowed. Issues involving individuals or students in litigation are subjects for participation. The public is urged to follow resolution processes online policy or they individual schools. For those processes are designed to address issues. It should again be noted that public participation is not designed for this purpose, and the board will not take action based on the participation. The board may not respond to questions posed by citizens during presentation, but may instead take these questions advisedly for response at a later time unless a member of the board chooses to ask questions. Speakers should remain at the podium to answer questions. First, public input is
Pamela Wheeler, 1,001 Trenton, Georgia. The reason for addressing the board tonight is concerns renovation of the facility that's needed into our weight room. Parents and softball players, women, softball, baseball, hitting is located inside the softball field house, which is referred to as the facility of tennis courts. That you saw did appear pretty recent. We've met with the coaches, the principal, and the superintendent to take the proper change and learned that the vote to approve renovation takes place in April 2023, and softball is not in season. And we pray the board to provide clear, concise picture of the representation voters have on the softball program. Males in the weight room and females changing. This being an issue is the weight games. So softball players do not have a locker room that's provided at a host site. When we have away games, they're required to change the home locker room, gather their personal items, and try host site. Depending on travel time, they can be in the locker room as early as noon to change and leave. So the school proposed solution. Team coaches will be responsible for standing guard while the females are in the locker room. It's not a realistic request. We have one coach that drives the bus. The other coach to get items together. The accountability of classing and leading the remainder of the school day. The second proposed solution was to door that adjoins the new weight room and girls' locker room permanently deadbolt. I believe that Mr. English has said has taken place. So the concern about that is while it's not an issue for the weight room, two doors to exit. There's only one door now to exit through the girls' locker room. To get outside. It's a door that opens out. So it's barricaded. There's no way to girls' space at this point on. There's no keys. So newly established hidden lanes in the upper portion of the gym are not near player personal equipment. So they've utilized these hidden lanes prior to games for warm-ups and during inclement weather. However, the bats, et cetera, are located in the locker room. So this is increasing time there is taking them to the meeting in order to warm up for a home game. Out at 10, home game starts at 5. They're having to go down to locker room, change, grab their gear, and back up. This is here in weather. We're now sending our players across the parking lot to the field house, softball field house to gather their locker room, and travel back to the weather parking lot and here to the facility. It's a greater risk of injury for a kid at this point. So the school proposed solution was that the school was equipped to put up their hats, or bats, balls. My child still has to go down there, her bat, her batting gloves, that's also just purchased, and that's $100 fees. So that's quite a bit of purchase for school, come out of a PD. Budget. Third point of interest, the heating lanes are not set up for training. I toured the building. The vote was made in April of 2003. Softball season began the first week of August. The hitting lanes are necessary for training softball players. As of August 3rd of 2003, net hung and about 30 foot. It's my best guess. I'm on a contract. 30 feet of the floor is exposed to concrete. It's been repaired. But that's repaired. But where the hitting lane is being pulled, the floor is still. It's not even ready. Had from April to August to prepare this on its own. The school solution was that they plan to, and I'm not going to give a date, plan to build a lean-to out by the fence. It would be a covered area. It's still not accommodating severe weather. The heat had the past 30 days brutal, and they're still practicing they need to be in it, but they're hidden has air, be safer for them. Still covered is not going to protect the rain. The three field houses, this is commandeering more than 50% of their building, the softball field house. When the proposed solution was to proceed as planned, we would like to add that as of today, the outside hitting lanes they tried to use those and had to clear them of weights before they could even get into the outside hitting lanes. Those were riddled with the weights from the outside workout facility. After much discussion, we're not here to just complain. We want to bring to you proposed solutions. We do have some, and the parents want to be involved every step of the way. We will help any way we possibly can. The temporary solution would be after that.
Your 5 minutes is up. If you could leave those solutions that you have with Mr. Engel.
I have gone over it with him. I would rather kind of leave it with you.
Yes, you can.
Thank you.
Okay, the next, official participation person is Jeff Poston.
Good evening.
Can you state your name?
Jeff Poston, 136 Jody Lane, South Glendover. First of all, I want to say I'm not here to attack anyone at all. I'm super excited that there are parents who are finally getting on board with us building facilities that we need here at the high school that are much more needed than any other project in the county, in my opinion. I welcome allies. A little bit about my background. I graduated from Northwest Georgia in 1992. My wife graduated in 91. We've had 4 children attend the school system here. 2 were girls. 2 played softball and basketball. One is a drama teacher in Lynchburg, Tennessee now. One's a softball coach in South Georgia. Had 2 sons attend here. One was in the band. My wife was in the band. My other son was quarterback on the football team and wrestling. So, to say the least, I support and fight for every single program here in this county all the time. So the issue that I have is not really with wanting new facilities. The issue that I have is with the misinformation presented on Facebook that attacks the football team. The first one that I want to address is the bus situation from a couple weeks ago. I don't demand buses. I don't tell what buses I get. I put in a bus request like every other coach. I get an email saying, hey, so-and-so is driving your bus. You've got 2 buses. These are them. And we get on the bus. One of our buses that day, in fact, did not have air conditioning, and I rode that bus. So that is just misinformation. Charter bus situation. The school system doesn't pay for anything to do with the charter bus.
This is
No board money, school money, system money has ever paid for a charter bus for football. We raise our own money. We have over 50 kids. We have more than double most programs. We're able to raise more money from Wolverine cars and selling signs and getting donations and concession stand and gate money. So that all comes out of what we do with the charter. The other thing I know address, board money, school money, system money, was addressing the charter bus for girls dressing in the locker room, boys and have over, girls were never in that locker. We had more than double training programs, so we were able to raise over 2 years. We never had an issue with that. The only people that had the keys to that locker room, I don't say she's staying and gave them people that have keys to that locker room. That all comes out of the softball coaches. The other thing I want to stress, and now it's a safety issue, maintenance, which is good. Boys dressing, or girls dressing in a locker room. The comments about everything being able to fit back in the old weight room just proves that you were never in the old weight room when it was being used, because it was, they had keys to that locker room. It was so cramped, people got hurt in there, would fall on each other. It was a very dangerous situation, and now because Coach Pruitt moved everything upstairs, that was very welcome indeed. The comments are disappointed that we had things fit back in the old weight. Everybody's in just proves right now we're never in the old weight room. My kids were wrestling because it was taken out outside. It was so cramped, people got hurt the hottest time all year. It was a very dangerous situation. Trying to stay hydrated and move everything upstairs. That was very well done. You could tell the heat got us very disappointed that we had to move things. Wrestling is going to be everybody's inconvenience for the wrestling to go to. We have to drive across town in school traffic, working out, outside practice until 4 a.m. So we don't get out till late. The hottest time of the year upstairs. The last couple of years has been awesome. Trying to stay hydrated and play football games. Start right after school. Get out of there by 5 o'clock. Get home with my family. The kids have been able to get home. Wrestling is going to be these two issues with crossing school traffic, drive across town in school, waiting in the school line, getting chewed out for parking in the wrong spot. Get out, have a lay bathroom over there was upstairs. The last couple of years has been awesome. So when girls in that school, we do have girls in that, so I start right down the hallway to get out there by 5 o'clock. Was all home when I was there. Kids in elementary school, I went to worry about the bathroom down there. Issues crossing school traffic, changing, so that's good. You know, waiting in the school line, getting chewed out for parking in the wrong spot. They only have one bathroom. It shouldn't be at the expense of one. They see that people should be respected. Girls that have personal attacks, that's why I have to take them down the hallway, emotionally charged with the old left office when I would also like to challenge the board and then almost misinformation. So they can use the bathroom down there, but they have a separate closet, don't respond to anything else, at least put facts out there. So that we all want a bunch of upset boys, and it shouldn't be at the expense of others. They feel like they're being, people just get respectful to girls. It's a personal attack. Grew up and emotionally charged rhetoric should be. The new hitting lanes that will be upstairs will be twice as nice as what's there when they finish it, but they're just not finished. One thing I'm happy with this junk's back finished there. So 100%. I went to deal with a bunch of the other issues that got me upset the other day, and I called you and you did it, and that we had civil conversation, and they grew up. But calling for a boycott of any program or any game. The new hitting lanes that will be upstairs will be twice as nice as what's there wearing or any point or just not any place. I think I'm fighting against what's best for all the kids. Then you are 100% wrong. I hope that we all. The other issue we got me upset the other day, and I called the fight for our kids to get what they deserve. Conversation and remove the comments. They're calling for a boycott of any program, or any game is absolutely ridiculous and selfish. And I don't think it had any bearing or any point, any place in fighting for what's best for all the kids. I hope that we all can learn to fight for our kids to get what they deserve together one day.
I recommend the board approve the 2025 capital outlay application for Davis and Dade Elementary School. I recommend the board approve the 2025 capital outlay application for Davis and Dade Elementary School.
So we are still in the process of closing out college 23. So for our general fund, you guys have some projections. Like I said, the number of cards projected change, which the year is officially closed. But we're still looking at our revenue. The largest majority of almost 60% is from the community, which is our state and local funds. So we are still in the process of closing out college again. So for our general fund, the largest majority of our expenditure projections, like I said, the number of cards projected change, which the year is officially closed. Moving forward to our small revenue, this is current, so this is July 1, 2023, which is actually July 31st, 2023. That's 8.2 our expenditures. Again, these numbers are subject to change, counting down. But in Splash 5, our previous month's balance was $1,535,344 Splash. This is current, $190,2023 interest through July 31st. There was a service fee error of 8.73%. We issued checks for $82,000. But in Splash 5, our previous month's balance was $1,455,341.69. And we are $190. Our previous month's balance was $4,594,544. We issued checks for $82,000. We earned $1,181 in deposit balance for Splash 5. We collected $342,121 in sales tax distribution. In Splash 6, our previous month's balance of $4,411,535,544.28. And our enterprise account, $1,189. Our previous month's balance was $501,348.41. We earned $127.75 in interest. Leaving a balance of $5,911,635.38. The next section you have is in our enterprise account of revenue, which is also tied to Splash 7. As far as previous month's balance, we have $1,048.41. July that from the FY 23-24 we have some slight increases, leaving a balance of $501,000. Our construction in progress is our DES HVAC. The next section we have is Cherokee comparison of revenue. The total or the original contract amount was $1,274,000 collections. We have paid a total of from $194,695.46. Leaving a balance of $779. Construction in progress is our DES HVAC, which is for Cherokee Mechanical. Our grant total, the original contract amount was $1,273,023. This is subject to change slightly, not much, $494,695.48. Leaving a balance of $779,304.52. Our grants, we've expended roughly 80.45% of our grants for FY 23. This is subject to change slightly, not much until the year is complete.
I recommend the board approve financial measures as presented.
Motion to approve the financial motion. Second. All in favor? Next is
I recommend the board approve.
Next is transportation. Motion to approve.
This year has been an interesting year in the transportation regarding, I've never seen a year like we've had this year, where in the first 3 weeks of school, we've had such numerous major breakdown, mechanical issues with buses. We had one where they came, this year has been an interesting year in the transportation regarding, I've never seen a year like injectors had this year, where in the first 3 weeks of school, we had but numerous. This happened shortly after school started. You have a breakdown of mechanical issues. On one of our buses, our newer buses, and one where they came to, it's called the DPF, the diesel particulate filter. This is an emissions component that was required by the EPA, but it started in 2000. This happened shortly after school started. You have a required you to put on. And buses are now designed, and new buses are designed, when this goes out to, it's called a DPF, diesel particulate filter. You don't have a emissions diesel particulate component out. On 19-2, our filter started this year, it just basically just had a required to be put on. And buses are now designed, the sad thing is, when this goes out, our warranty on the buses went out. you don't have a choice. If this happened about August the 8th, on 19-2, our technician diagnosed this year, it just basically just had a catastrophe. So now, where we are at now, the cost, you have the cost involved, basically you have one choice. You have to get warranty on from the dealer has went out to be able to get first. This happened about August the 8th. What we've done is we presented you with two estimates. This is for the estimate, and it's, you're looking at basically the same cost for the. So now, where we are at now, the cost, you have the cost thing. We took basically, you have one choice. You have, which is the Smith, the one that starts to bus from to Georgia, which is Rush Trucking, and you can see what we've done basically are two estimates. This is for the estimate, and the difference, you're looking at basically the same cost, the other costs, a little labor involved, the same, the same thing. Part, we took about $14,000 dealer in Chattanooga, the international dealer, labor is about $1,000. Smith, the one that would be, best estimate we can get is going to be Trucking, and you can see that that's just our basic, the parts close to the same. We have to have this part, or the bus, the other costs, there's a little labor involved, 2019 model. The part, is about $14,000. We are, the labor is around $1,000, give or take, because the best estimate we can get is going to be. So I'm asking that we Chattanooga purchase that part. Now, the caveat in this, and I've given you another sheet, we have to have, there is a part, they call it request for policy, and it's a 2019. The dealer warns, it's a good bus, we need the bus. Typically, when a part goes out that close to the warranty expiration date, they will cover. So I'm asking, and they've given us not just an assurance that caveat in this, and I've given you another sheet, is manufacturer is a warranty the part, will provides either all of the dealers warrants reimbursement for this part. Typically, when a part goes out that close to that is not your expiration date, and it is not going to be reimbursed until after they've given us not an assurance that very submit the request for policy, and that manufacturer will bus, but they are they're very high. Feel like either all of the costs, we're talking 10 days after the part's expired, at least be substantial. They do feel that we will be. Now, that is not guaranteed, and it is not going to be reimbursed until after the part is purchased, although that is not guaranteed. So our request is for the funds to be given, but they are having a very positive feel like, because, we're talking 10 days after the warranty expired this point.
Typically,
They do feel that we will be reimbursed for this part, just substantially for another amount either, although that is not guaranteed. So our request is for the funds to be given to purchase this part, have us repair sure
they don't just put a DPF filter on there, charge us $10,000, $15,000, whatever it is. Typically, and then we're still out a $10,000 turbo after that, just when the next filter was such low. So what I'm saying is, my concern is make sure that they find out why it failed. If it is just the filters, other expenses. Anyway, we gotta get the bus to him, but I just want to make sure they don't just put a DPF filter on quite a few trucks, $10,000, $15,000, whatever it is, and then we're still out of nothing, no turbo after that, without turbo, the next filter, something failed. So what I'm saying is, let's make sure that they find out.
And to your point, and that's a good point, we have asked the dealer, and we have brought that up. Something down the line further might have caused it, up the line further, caused it to make this happen.
Cause the other one to go out again.
Exactly. Two things involved with this, Lee Smith, the one that are, and to your point, and that's a good point. We have asked him, and they assured us that once they are given something, the first thing they do might have caused back up the line and assess every other part to see, to make sure there's something going on. Exactly. Two things involved with this was a catastrophic. Lee Smith and this PPF just done went out technician. It just he came and they assured us that once they are given the go-ahead, the first thing we want to make sure that there's back up the line to assess every other part very see exactly if there's not something going on to contribute to the cost. And the reason is this was a catastrophic. I mean, this PPF just and they are going to just to make sure that we don't. And it had to get hot for that to happen. So we want to make sure that there's not something else contributing to that. Yes, for that very, that's exactly why.
If it's regenerating too much.
So will they check that prior to ordering
It just
and pay
failed.
for the
That's
part?
perfect.
Once we give the approval for the work, they are going to do that, to make sure they do that when they come to put the part in, or when they come to do the installation of the part, before they put it in. you're gonna go back down the line and check everything else anything else that might have contributed to it.
So will they check
It could have
that prior
caused
to
such
or are you paying for it?
And it could have, once we give the approval for the work, I mean, that is part of that package. You know, they'll do that, like when they come to put the part or something else, or when they come to do the install, we won't know until before they put it in, but they're not gonna do that until we say, okay, well, anything else that might come out, it could have caused such. And it could have been just 3 years old stuff. I mean, it could have been, yes, that's, you know, that's unlikely that there was something else, but we won't know until they see it in there.
Thanks.
But they're not gonna do that until we say, okay, we're gonna fix
I
it.
recommend the board
Come out.
Lee Smith.
If we don't do around nine,
Yes, yeah, that's 3 years old.
15,000 seems cheap.
Yes, it does.
Thanks. I recommend the board approve, Lee Smith. I recommend the board approve accepting the Dade Middle School ESSER math grant for $3,177 and the Safer Georgia Schools grant for $250,000 and the ESSER 2 custodian bonus grant for $2,750. I recommend the board approve accepting the Dade Middle School ESSER math grant for $3,177 and the Safer Georgia Schools grant for $250,000.
I do want to point out that 250,000 seems to be the cap reward on that particular grant. I think that's huge that we got the max with Dalton and some of the other counties that we compete. I didn't want to say that or anything, but I'm just
And
going
I will add our SROs, that's the contracting service.
that 250,000 seems to be the cap reward on
So they send
that
us an
particular
invoice
grant.
each quarter.
I think that's huge that we got the max with Dalton and some of the other counties that we
I'm
compete.
glad you could.
I don't say that there.
And I will add that our SROs, that's a contracting service,
Yeah.
so that's a, and it comes from general fund, so they send us an invoice each quarter.
The next thing is executive session, personal property, safety, and students.
I'm glad you could. That's going.
Jennifer made first, Danny made second.